or they're a single bird? Do they live on their own? Do they have any animals associated with them? And that sort of thing in order to narrow down to your diagnosis. One of the things that we just did, so the second year class just did a necropsy on chickens. And one of the things I really recommend to them is to palpate the keel bone. So the keel bone is that bone that runs between the two pectoral muscles. And if it's prominent, it's a sign of malnutrition. Now, why would it be prominent? So you have significant muscle atrophy in the pectoral areas when birds are sick. So for instance, this bird here, you can see that they're about to do a necropsy, and the keel bone is prominent because the surrounding muscle is pretty much gone. Obviously, there's some other issues as well. We see some petechiation in the muscle, but the thing that stands out, indicating that this bird either is in poor nutrition or has stopped eating because of illness or so before we talk about the diseases, we do need to know or at least have an idea of what they look like. So the order of Psittacines or order Psittaformes is an important order when it comes to pet birds. And they fall under three categories: the Loridaes, the Psittacidaes, and the Cockatoides. So these are the typical birds that you expect to see in your practice if you do exotics or pet birds. So Psittacines are characterized by their strong hooked beak, as you can see here from this picture. The beak fits over the lower portion of the mandible, and they use it for locomotion and prehension, so holding objects. And they have zygodactyl toes. That means they have two digits that point forward and two that point backwards. So between the two characteristics, we can definitely tell that a bird falls into the Psittacine family. So here's some pictures of some birds that fall into that category. So the first one is a lorikeet. And I'm not going to ask you about the breeds, but it's important to know what they look like. So this is the bird that represents where I'm from. Anybody remember where I'm from? Dominica. So this is our national bird, and it actually sits on our lovely flag. And it can be predominantly found in the island, even though at this point they are close to extinction, because we also, like Puerto Rico, had we had a Category 5 hurricane last year that wiped out a large population of these parrots. But they're slowly trying to rebuild the population. Cockatoos, as I think most people are familiar with what these look like, and our cockatiels. So again, they all have the similar hook beak and the zygodactyl toes that make them fall in the category of Psittacines. So bacterial diseases, we'll talk about two main ones that are very important: psittacosis and mycobacterium. The first one is psittacosis. It's caused by Chlamydophila psittaci. So that's the etiology, and it has a tons of different names. In most books, you'll see it as psittacosis. It is a zoonotic disease, so people can get this. This is the disease I get concerned about in necropsy. Excuse me. When a bird is brought in for for after death. So the term psittacosis is predominantly used in people and Psittacines, and the term ornithosis is used in pigeons, doves, and other birds. Thank you. So it's very important to know any of the details that I put in bright green, because these are the most important or things that stand out about this disease. So clinical signs, they typically come in with some sort of respiratory disease. So it could be a nasal discharge, respiratory distress, they may also have a conjunctivitis. The thing that stands out from other respiratory diseases is the fact that they have lime green diarrhea. Okay, so let's see if this video would work up here. I have a bad feeling.
Her breathing, I like to spend a little bit of extra time with people because I start seeing things that you don't see when the birds flying down.
Yeah, right, yeah.
And what we're noticing here.
They're always slightly healthy, yeah.
That's exactly right. That's exactly right. So what we're seeing here now is a birdie that is breathing fairly heavily.
Yeah.
Right? She's had plenty of time to get over the examination. She has a multi-nasal discharge. She's sleeping in a strange environment.
Yeah, that's something people really
Right.
Yeah.
So these are things to watch for, and because of that, how long ago did you buy her from a pet shop?
I bought her, I would just say it wouldn't be any more than 7 days ago.
Right, okay. Well, seeing this behaviour concerns me.
But when I stood, she was amongst 4 other birds.
Yeah.
She was by far the most happy and she was sort of, she looked alert and whatnot.
Yeah, right, sure. But did any other birds look obviously sick?
No, that's not.
Right. Because it's a mistake to buy birdies from any cage where there's a sick
Oh,
bird.
yeah.
Right, so, were any other birds in the adjacent cages looking sick?
Well, they only had these, they had 4 cockatiels in the one cage.
Right.
But they all look pretty good. But this one just looks a bit more lively, you know.
Right, yeah, sure. Okay, well, this behaviour concerns me. And the first thing I think of being a cockatiel is chlamydia. And I'll have a listen to its lungs, listen to the lungs, or his lungs, and just have a look there. But I think with a new bird acquired from a pet shop, you'd be very wise to put the birds on a 45-day, at least 30 days, and preferably 45-day, or sort of sit there in the drinking water, or to do that, particularly if you're going to be house pets. So they're going to be house pets, or, well, you can go further, you can do a blood test for chlamydia. That is an antibody test. The blood test is an antibody test and it relies on there being antibodies present. If the bird has just caught the infection recently, then in the first, for the first 17 days, the test shows negative. Then after that 10 days, infection shows positive. So that test is about $85 if you want it done. But that breathing is not normal that we're seeing. It's a lot more exaggerated than right.
Yeah.
So she was playing, master science. Initially. That's and this is the benefit of spending a few more hours with you, that's relaxing. And then she relaxes, and we see. And it's also the benefit of spending time with your birds, just sitting quietly with them. Because for the first 5 minutes they're with you, you're usually on guard. And then when, what are you going to do next? You're going to catch it, you're going to do whatever, right? Then if you just sit quietly with them and spend a bit of time with them, you'll observe a lot more and you pick up these sorts of things. So I'll get a stethoscope and we'll see what we find.
So what do you think he should have also mentioned to the owner? It's right. So it's a zoonotic disease, and it will be important to mention that in case this owner has children himself who has had contact with the birds, and then we'll talk about the clinical signs seen with people. Yes.
Is the vet or the owner legally obligated to notify the pet store where he got the bird from?
When you put the word legally obligated, that's when we have a bit of an issue. So legally, or I would think ethically, I would think it'd be a good idea to do that. I can't talk about the legal aspects, you have to ask an attorney. But I would think there should be, especially since it's a zoonotic disease and it spreads very easily from one bird to another, and just to know the fact that birds hide their clinical signs, I do think that would be something I, as a veterinarian, would want to do. So find out where the bird was received or bought, and then inform them that there is a case of silicosis. That's a very good question when it comes to ethics. So the lesion, so if you do a necropsy on these birds, you can see common clinical signs associated with the respiratory system, such as pneumonia and air sacculitis. But the two things that stand out with a necropsy on these birds is hepatomegaly and splenomegaly. So when you open up the bird, the first thing you'll see is an enlarged liver and an enlarged spleen. So one of the practices that I would recommend that you do when you do go to practice is to always wear a mask when you're doing a necropsy on a pet bird. We typically don't do those, use masks when we have chickens, but specifically when we're talking about birds that can have these zoonotic diseases, and we can get them, a mask is recommended. So this is an example of what lime green diarrhea would look like in a bird with silicosis. So sort of that bright color associated as a clinical presentation. And again, so has this class ever done an avian necropsy? Has anybody ever done necropsy in a bird? So what does the spleen typically look like?
Round. Yeah, round.
So this is something that was unusual that the second year students saw yesterday, and we'll be doing that today. Is the spleen is shaped like a little marble or ball. It's not an elongated spleen like what you see in mammals, but instead it's a rounded object. So this is the spleen, and it's approximately 3 to 4 times the normal size. And these are air sacs. They look a little hazy in this picture. But normal air sacs are clear. So the way that you can tell that they're cloudy is that you're unable to see through them or even read, as you say, a newspaper through those cloudy air sacs. So cloudy air sacs are non-specific lesion, meaning that they could occur with really any respiratory disease, but enlargement of the spleen and enlargement of what other organ? Liver is a high indicator of silicosis. So this is from a study that was done in Cornell where these birds were infected with silicosis. So this is the normal size. And as you can see, it's multiple times enlarged. And if in some cases you have discoloration, instead of being diffusely dark red or maroon, we have pale areas in those spleens as well. So this is another case of silicosis where you see a combination of the air sacs being cloudy and also an enlarged spleen. In this diagram, they have removed the liver, so we can't see the true size of it in that case. So just for orientation, can anybody guess what these are? If you've done a necropsy before, especially on a chicken, the lungs are actually on the back or, aspect of the bird. And so these are the lungs. And as I said, these are the air sacs. And what would this be? the heart, right? And this is the spleen. And we're looking into the coelomic cavity and other aspects we really can't see too well are present. So intestinal organs in the back, and yes. So this is a radiograph of a bird with an enlarged spleen. And obviously I can't tell you last time I read a radiograph, so I got something that was labeled to help me out. So we have enlargement of the spleen. So that would be a first indicator that we have some issues going on. We will talk about another disease, which is a viral etiology that causes enlargement of the spleen. So that will be in your differential list. Can anybody tell me of a viral disease that causes splenic enlargement? So it's called Pacheco's disease, which is a herpes infection. So that's on your differential list for psittacosis. So how do we diagnose? So this is a bacterial agent, so you do bacterial isolation. So you take a nasal swab or scraping of the conjunctiva and submit samples for an ELISA test, or we could do a serology as well. Now the thing that stands out about psittacosis or Chlamydophila is the finding of elementary bodies. So I'm sure you're familiar with inclusion bodies. They're similar. So inclusion bodies are seen in what agents? They're seen in viral agents, but elementary bodies are found within cellular structures, and they look very similar to the inclusions, but they are somewhat different in terms they are only seen with this bacterial agent. So if you do a culture or you look at it histologically, you can find elementary bodies in the tissue specimens. The treatment of choice. So in prior classes, I used to give a list of treatments, but for NAVLE purposes, and really the best treatment is the use of doxycycline, but used for 45 days. So where do we see a problem with that?
Compliance.
So antibiotic resistance, yes. What else?
Compliance.
Owner compliance. I don't know about y'all. It puts you on 4 days of antibiotics, and by day number 2, you're like, I just forgot, or I feel better. So 45 days, putting this in the drinking water can have issue with owner compliance, but it's important to remember this is basically the drug of choice and treatment of choice for these birds. Most cases of psittacosis that I've seen, unfortunately, the animal succumbs to the illness. So, but if they do, if it's an early infection, you do want to give them antibiotics. So we say it's a zoonotic disease. So it's also reportable. So reportable indicates what? Who do you have to contact? The state vet. So when you graduate, one of the first things that you do when you relocate is to know who your state veterinarian is. So that when you have cases that are reportable, you want to make sure you send it, tell the person, the right person. So psittacosis is a zoonotic agent and it is reportable. By the end of the semester, you should have tabled a list of diseases that are zoonotic, a list of diseases that are reportable, and the ones that are both. And this is for both pet birds and for chickens as well, especially reportable. So this little short video talks about how people are affected by psittacosis. It can cause a variety of Wait a minute. Alright. I don't know where the fake arm part came from, and there's another video in the back.
Psittacosis is an infectious disease usually transmitted to humans with birds in the parrot family, as well as from turkeys and pigeons. Birds in the parrot family include parrots, macaws, parakeets, and cockatiels. The disease is caused by a type of bacteria known as Chlamydia psittaci. Because this disease birds in the parrot family is occasionally found in pet store workers, veterinarians, and people who have purchased an infected bird. It may also be found in farmers and slaughterhouse workers who process turkeys and some other types of birds. The diagnosis of silicosis can be difficult. Few infections are reported each year in the United States, but many more cases may occur that are not correctly diagnosed or reported. Silicosis is usually spread by inhaling dust from dry droppings from bird cages and by handling infected birds in slaughterhouses. Human to human spread has not been reported. Waste material in the bird cage may remain infectious for weeks. In humans, the symptoms are fever, headache, chills, and sometimes pneumonia. The incubation period typically ranges from 5 to 14 days. Longer incubations have been reported. Some people may only experience mild flu-like illness or show no illness at all. However, fatal cases have been reported. In birds, the symptoms include poor appetite, ruffled appearance, either nose discharge or diarrhea. Occasionally, birds may die from silicosis. Also, some birds may shed the organism while exhibiting no symptoms. If birds are kept as pets, clean the cage often so that fecal material does not accumulate, dry up, and become airborne. Test and/or separate birds that have been in contact with other birds outside of the home to reduce the chance of bird-to-bird spread. These are just a few things to know about silicosis. To learn more about this microbe,
So one of the issues is the clinical signs are really non-specific. So think about if you have chills and a headache and you go to your doctor. Do you think they may know about silicosis, but that would be really far on their differential list. So have you ever been to a doctor and they ask you, do you have a bird? Anyone? Did they even ask you, do you have, oh, Annie has it. She's a great doctor. Or if they ask you, do you have a cat? If you have any animals, that's not typically on the sheet when it comes to clinical signs. And unless you're a veterinarian or you know about diseases in animals, that's really very unlikely. So most cases are not diagnosed unless, unless the individual dies and they may do a culture and then they discover that it could have been silicosis. So what type of people are most likely to die from silicosis?
Young, old, young or old.
Who? Oh, thank you. All right, all I heard is so old and young. So these are suppressed individuals, and then they would die from this bacterial agent. All right, any questions about silicosis? So what are the important things to remember about this disease? Splenomegaly and hepatomegaly. What else?
Green diarrhea.
Lime green, not just green, lime green. Lime green. Lime green diarrhea. What else?
It's zoonotic.
Very good. It's a zoonotic disease and it is reportable. It's important to know the etiology. So Chlamydophila psittaci used to be called chlamydia, but now it's called Chlamydophila. And that's it. And really how to diagnose and treat. So diagnosis is really easy. So you do isolation, and what is the drug of choice? Doxycycline for 45 days. If you know that, you have gotten those questions on the exam and on the NAVLE correct, because that's really the most important things to remember. What the disease looks like, how you diagnose it, and how you treat it, and keep it moving. All right, so the next bacterial disease is Mycobacterium. There are different subspecies that we see in birds. So Mycobacterium avian, genevense, tuberculosis, and bovis are all the different types that you can see in birds. They all present the same, but it's important that you have those on your radar when you have a bird. So this disease is not anything different than we've in other species. It's weakly gram-positive, typically acid fast. So we use a Zeal-Nielsen stain histologically to diagnose it. And can anybody give me another acid-fast bacteria? Nocardia, very good. What else? Actinomyces, very good. Yes. So, but Mycobacterium is the one that really stands out, and you want to make sure you do an acid-fast stain. Obviously, that's histologically. So, Mycobacterium can look like a lot of different things. So, in people, in goats, in bovine, it typically presents with a multinodular appearance. So we can see that in the lungs, in the liver, in the spleen, in the GI tract. So this is the liver, and you can see you have multiple white areas. These are the heart. This is a cross-section of a spleen with Mycobacterium. And this is the intestinal area. We're looking at the mucosa, all macrophage based because they're all granulomas. So the same thing occurs in our avian species. This is a particular unusual presentation of Mycobacterium. As you can see, you have enlargement of this area and it's multinodular. So I wouldn't even think of Mycobacterium if I looked at this. I would think of some sort of bacterial infection affecting the birds. What bacteria causes conjunctivitis in birds? Dr. Gorham taught you. Did he teach you conjunctivitis or?
No, I did.
What has caused conjunctivitis?
What's that, Brent? Oh, when's your small animal test?
Tomorrow.
Oh, when's your small animal test?
Tomorrow.
No wonder you're like glassy eyed. I get it. No problem. So diseases like Pasteurella multocida can give you that. And a whole list of others. I think we talked about fowl cholera. Does that sound familiar? I know that's not in a dog or cat, but yes, I understand. This is another case of Mycobacterium. So we have the heart right here, and this is the liver, and you see multinodular regions throughout. And this is showing you a histologic appearance of Mycobacterium. These are multiple sort of clusters of macrophages, and we did an acid-fast stain, and it bright pink appearance. So pretty. So clinical signs really are dependent on where the primary infection incites. So if it affects the GI, it could cause weight loss. In general, we see prominent keel or pectoral muscle atrophy associated with that. Lameness can occur if it is predominantly within the bone marrow. If it's in the liver or spleen, if you have rupture of those organs, you can have massive hemorrhage and acute death. And gross findings are typically what we see with granulomatous disease, which are firm, raised white nodules. And again, this is just showing you H&E. So I'm not going to ask you about the pathology too much, unless it's very necessary for a diagnosis. So you might have the answers to this, but you're probably thinking, Dr. Martin right now. So let's just take a little break. So a baby duck, this has nothing to do with class. This is just to take a 2-second break. A baby duck is called a duckling. What is an adult male? Now, if you have the answer in front of you, don't say it. Did you know that, or did you? It's called a, yes. Drake, like the rapper, singer, whatever he does. Yes. An adult female duck is called a what?
An adult female?
It's called what? It's called a duck. I looked at the answer there. And a group of ducks can be called a raft, a team, or paddling. Yeah, and he's stealing her money. She got distracted.
That duck been trained. I need a duck like that.
What?
I said I need a duck like that.
That's a good duck right there.
Right. She gotta feed her
Like that.
babies. She gotta
That's
feed her
called
babies
a
somewhere.
thief. That's okay.
I'm gonna just keep my wallet locked up.
All right, let's keep it moving.
I'm gonna train my dogs to do that.
So we talked about bacterial causes. We talked about psittacosis and mycobacterium. And now we're going to look at some viral diseases. We're going to stop after the first one because Dr. Gorham wants to return your exams 5 minutes to the hour. So in viral diseases, we have two diseases that are important. Amazon tracheitis and Pacheco's disease. Both are caused by a herpes virus. And then we'll also talk about Borna disease in these pet birds. So Amazon tracheitis, as the name implies, affects Amazon parrots. It is a herpes virus, and it's a variant of infectious laryngotracheitis. So ILT, or infectious laryngotracheitis, is the exact same disease, but we see that in chickens. So the clinical presentation is similar, even the etiology is similar. So it's going to be important to know Amazon tracheitis in Amazons and infectious laryngotracheitis in chickens. So clinical signs. They present with a respiratory presentation. Are you okay in the back? There's a lot of laughing. Can't be pet birds, it's not that funny. It can't be small animals, that's not funny at all. You're my bird caller. Great. You're fine. So the clinical presentation is they present with their neck stretched out. Why do you think they're stretching their necks out? They can't breathe. And the reason they can't breathe is typically their trachea is filled with blood. They do open mouth breathing and they sling their heads back and forth, and you see the blood, and it'll be impaled on the wall. So it looks like a bloody murder, pretty much. And so that's the only way they can get the amount of air down through the trachea is to remove the blood by slinging their heads back and forth. This disease is transmitted by inhalation predominantly, but it can also be transmitted by feces. So this is a chicken, obviously this is not an Amazon. And as you can see, he's open mouth breathing, open his mouth. And you see this, it's not a, what do you call it, a loogie? Loogie? I don't know. He has this long, extended material coming out of the oral, out of the mouth, and that's probably from the trachea. So he's trying to get it out so that he can breathe. This is a classic presentation for this disease. So the primary lesion we see is hemorrhagic tracheitis. So we see hemorrhage and inflammation in the trachea. We may see a conjunctivitis. This is a herpes virus, and so what type of inclusions do we expect to see with that? Okay, I have the answer. I know y'all studying for small animal, but IN means what?
Intranuclear.
Intranuclear, yes. So there are intranuclear inclusions, okay? So how would you diagnose this disease? You would find the intranuclear inclusions. Fluorescent antibody test, ELISA, or PCR can be done with that. There right now is an intraocular vaccine that we can use to vaccinate these birds for Amazon tracheitis, but it varies from state to state if that's part of their vaccine protocol. So this is a classic picture of Amazon tracheitis. If you notice, this is a chicken. So we're looking at the half-cut surface of the trachea. So we see the tracheal rings in the background, and we see that it's lined by a red to really black material, and that's blood. So this is a classic presentation, and I love the use of office supplies and necropsy. You just kind of pin it back so that you can look at the tracheal mucosa. This is from a peacock with probably ILT. And again, we're looking at the trachea being lined by blood. As we go through, we'll talk about some other diseases that causes hemorrhage in the trachea, but for right now, I would put hemorrhagic tracheitis, and one will be ILT or Amazon tracheitis as you make your list. All right, so I see that Dr. Gorham is here. And as I said, Dr. Gorham is going to return your exams, so we're going to stop at Pacheco's disease and take it up on Tuesday when we stopped. Any questions before we continue? Well, I hope y'all do well in your exam, I know you will.